So, Dr. V, I have been experiencing jaw pain and burning gums for 22 months since my upper molar extraction. What could be causing this?
Okay, so you've been experiencing some jaw pain and then burning gums, 22 months, for 22 months. If you have been if you've been having some burning gums for 22 months, and since your upper molar extraction, um, I can't really tell you without seeing you what exactly is going on with your burning gums, and so it is uncommon for you to be healing for after 22 months, and unless you had maybe there was some kind of a very minor nerve injury that happened that kind of triggered some kind of a nerve damage. And it's not uncommon for people to have some kind of a nerve damage that happens after the procedure. It could be as simple as when you had the injection, the nerve got triggered, and maybe the wiring or the nerve in that area was slightly different than like what we normally commonly see. It that could be causing some kind of a burning sensation on your gums, and so that's what I could think of. um, the jaw pain, one of the main common or one of the most common reasons that we see is anytime you have an extraction done. So you're going to keep your mouth open, particularly if your extraction was difficult. Then if you had to keep your mouth open for an extended period of time,
Mm-hmm.
then it is very possible then that's what triggered what we call it as a TMJ here,
Mm-hmm.
the joint here.
Mm-hmm.
See here, imagine keeping your mouth open like this for an extended period of time. So then you are going to have some kind of a damage or ligament damage that happens inside the jaw. That's what I could think of could have triggered. Or very possible that you are a grinder. It is one of the most common things that people don't know. And when they grind their teeth at night, and they probably did not know right before the dental treatment happened, and now they're able to connect, and that coincidentally happened, and that triggered the dental treatment, triggered the event, but it's not exactly happened because of that.
Mm-hmm.
Now you start to grind your teeth, and now you're going to start to have more jaw pain, but now you're trying to connect that to the dental treatment, but it is not connected to the dental treatment. So talk to your dentist, whoever it is, and if it is 22 months, and I would definitely recommend that you go talk to the dentist to see, find out what's going on. And before you ask, hold on to your thoughts.
Mm-hmm.
One thing is, you may have some other tooth pain or some other teeth that may be hurting that you may not even know. That
Mm-hmm.
is what triggering you to cause your teeth to grind, and now you're causing more pain or you're putting more stress in the joint. So definitely go talk to the dentist, and they should be able to help you.
Yeah, I was gonna say, did you want to maybe show the model of where the joint is? Those over
Oh
there? So
yeah,
maybe
there
they
we
can
go.
see the joint that you're talking about, possibly.
Yeah, look at that right there. Yeah, there we
So
go.
that's the
So
joint.
that's kind of the joint that we have here. So
Mm-hmm.
whenever we open like this, yeah, this is the jaw joint that you have. And whenever you have this, this is the lining in the joint, and when the lining gets damaged, it's almost like the arthritis, right? So I
Mm-hmm.
tell my patient, whenever you move your joint, then you may hear some clicks and some noise inside the joint because your lining inside the knee is damaged. So the same way, you may have some lining that may have gotten damaged
Uh-huh.
during do with like the time that you had to keep your mouth open. But again, talk to the dentist and they should be able to help you.
Yeah, great, wonderful.